up, guys? It's the Monago family. Hey! I'm Uche.
I'm Charmaine.
And we're the Monago family parent. And you are watching us. And thank you for watching us.
Thank you very much.
Thank you for joining us on this fine afternoon.
Yes.
Or fine morning. Or fine evening, wherever you are. So, basically in this vlog, if you're new to our channel, by the way, subscribe. So you join the family and you keep up to date with us. This vlog, we wanted to do this vlog, right?
Yeah.
Because we get asked a lot about different parts of our move to Dubai. And this is, I mean, we're trying to give you as much information as we can. For some people, just watch us on our move to Dubai content just because they're curious, and that's good. We love you, appreciate you, keep watching. And some people watch because they want to know, because they're thinking of moving to Dubai.
Yeah.
And we've had such amazing comments back from you guys on the value that you're getting from this content. And to be honest, we didn't expect it, to be honest.
Didn't, no.
No, we just started making these videos, just
I think,
talking about our journey.
I mean, I think when we were moving to Dubai, they asked lots of stuff online, but we didn't find anything that kind of related to us as a family.
Not that we could relate to.
That we could relate to, yes.
So
that's why we started it.
So we're happy to be your resource.
Yes.
But we only talk from our experience.
Yeah. We're not experts.
We just talk from our experience, right? So look, by the way, give this vlog a like now, just to support the channel. You know, your likes keep our channel alive. Yeah, so today we're talking about like Dubai healthcare basically, and how it compares to what we know in the UK. We know we've got people who watch us all around the world, so we're trying to make the content as relevant to everyone as possible. But of course, we're going to compare it to what we know in the UK, because that was our experience before we came here, right? We will tell you at the end whether we feel it's better or it's worse. So keep watching till the end, all right? Keep watching till the end.
Watch till the end.
And we will tell you whether we think it's better or not. But yeah, let's talk about our experience of it and I guess how it's different. So basically, the main things is it's all private, isn't it?
It is all private.
It is all private. I know in America that's the same situation, it's all private. I know in a lot of other areas in the world it's all private.
Yeah.
In the UK, what you don't have is you have the option to go private, but even if it is private, it's still kind of linked in with the government one anyway, to some degree.
To some degree, yeah.
To some extent anyway.
So you're subscribed to the NHS anyway, and then
Yeah.
if you want a top up of like going quicker, you use private healthcare.
Yeah, and it's not necessarily always quicker anyway.
I mean, it isn't.
It's
That's,
just, yeah.
I mean, that's why our comparison will come in more importantly, isn't
Later.
it?
Yeah. But don't give them a clue of what's better.
I'm not.
Overall, there's lots of factors
I could
to
tell
consider.
you UK is better. I could tell you that.
You don't know, you gotta watch the end.
know.
Go watch the end. So in the UK, look, we pay taxes. The tax system in the UK, look, it's a really serious tax system. You know, we've spoken about this in our other vlogs. Obviously, the tax system here in Dubai is different. Don't forget to watch lots of our other vlogs around this topic and about moving to Dubai and cost of living and so forth. We've covered that in there, but we're gonna focus more specifically on healthcare. So in the UK, you pay tax, and essentially when you're paying for this tax, you are basically contributing to the healthcare system.
I mean, I think you forget it when you're in the UK, because when you're paying this tax, you forget that it actually goes towards the NHS. So you are essentially paying for it, but you don't feel it at the time.
Exactly, and it's called the NHS, which is the National Health Society, I think.
System.
But every system.
Something.
Everyone calls it NHS.
I don't know, yeah.
Everyone calls it NHS. So basically, if you want to go to a GP in the UK, you've already paid for it. It's more or less free. There's no charge. If you go to a hospital, you don't pay. So there's a system where you do not pay at all, right? The NHS at the moment, the waiting times and the way the system works, I think it's fair to say it's not working as smoothly as it has done in years previously. So years and years and years ago, it worked really smoothly. You could see a doctor quite quickly and so forth. But since COVID,
probably worse
since COVID, the NHS system, in our opinion and being honest, has gone down, if we're going to be honest. It can take a long time to get treated for certain things, if that makes sense. And then, so a lot of people, if they can afford it in the UK, well, some people in the UK will try and go private, so they get things done quicker, and they pay on top of that to get things done quicker. So that's generally how the system works in the UK.
Yeah, I mean,
right?
apart from, I mean, it is good for, obviously, if it's an emergency and you have an emergency, they will treat you, of course. But for things like, I don't know, like physio maybe, or things like this, you may have to wait a really long time. There's serious waiting lists. Even like, for example, I can tell you my teeth, I was on a year's waiting list for something quite serious in my teeth. So that was an example of how long, and it isn't anything to do with the staff that work for the NHS, by the way. They're amazing. We love you guys. It's just a system that's set up for them, unfortunately, puts them in a difficult situation. But yeah, it's just strained. The whole system is strained for whatever reason. It's just strained. So yeah.
So that's basically the UK system. In Dubai, the system is private. And I know this is the same in a lot of the countries around the world, or pretty much all of the countries around the world. I mean, I don't know, I haven't done the studies yet, but yeah, it's basically private. So 80% of the people here are expat, people from other countries. Charmaine mentioned earlier, you were saying some of the people who are local here, who were born here and who are actually Emiratis, their situation is going to be different.
Yeah.
but we're going to talk for people like us who are moving over here and the other 80% that move over here to Dubai. So you pay for it here, essentially. The way that you pay for it is you can either pay directly. I mean, in Dubai, there is a law that you have to have like mandatory health insurance to some degree.
Yeah.
So I guess, yeah, everyone would have health insurance anyway. Depending on how much you pay, a lot of the health insurances is like there's a co-payment of a certain amount. So you pay maybe 10% or 20% towards it, and then the insurance will cover the rest, essentially. Or you pay nothing. There's some where you pay nothing, but they're obviously more expensive, and the insurance covers all. So there's a wide range of different types of health insurances available. There's just so many. We can tell you in detail at some point, you know, what we've gone with and what option we've gone with.
Yeah.
That's probably another vlog in itself. Comment down below if you want us to discuss that journey with you. But we just wanted to focus this one on you know, which system we think is better. And then, yeah, comment down below if you've got any questions on this, if you want any more information, talking from our experience, and we'd be happy to share it with you.
Yeah.
But we wanted to concentrate on this one, isn't it? So yeah, so that's the system. It's basically private, right? Now, in terms of how it all works now, we've been to the hospital 3 times.
Yeah, I think so.
3 times.
Yeah.
Since we've been here, right? 3 different occasions. What was the first one? Was it you were first?
Yeah, I think I was first. He went to hospital for me first, yeah.
So mum was first.
Yeah.
Went to the hospital. What was it? Do you remember?
Urine infection.
Urine infection.
Yeah.
Months and months and months ago.
Yeah.
We were in the hospital for a reasonable amount of time. She had tests. We went straight to the hospital. She had blood tests. She had everything done. We were out of the hospital in a couple of hours.
It was all done,
And she had her medication and plan and treatment and everything was fine.
Yeah.
Right? So that was done. I went to the hospital and basically I was out of the hospital quite quickly, quite smoothly. They did tests on me and found things that I'm okay, but they found things that they hadn't been able to identify in the UK. Essentially. So I thought I had an issue and there was an underlying issue which they didn't pick up on in the UK. But that's another one for another vlog. I'm okay, you know, don't worry about it. I don't want you to focus on this. I want you to focus on what we're saying here. But essentially this is what they found out. And I was in quite quickly. They did tests straight away. A few hours and I was home. The most recent one was Myra. She injured her arm, went to the hospital and she was seen by a pediatrician, and then she had an x-ray done, and this was all done within 2 hours.
Yeah, so consultation,
x-ray within 2 hours.
Yeah, and it was walk-in as well. So like,
walk-in, yeah.
I don't even think that was a hospital, by the way. I think that's like a medical, because in Dubai we have medical clinics. So there's medical centers everywhere where you can just walk in. By the looks of things, there's doctors there, there's pediatricians there. They have pretty much everything there, probably up to a level where they can do a lot of things. And then maybe, I guess if anything was like really bad, or I don't know, maybe they refer you to a hospital or you go to a hospital directly. Because I think with the 2 situations with me and you, we went to a hospital. But for Myra, we just went to a medical center, which might be an equivalent to a GP maybe in the UK, but
it's not a GP because they have x-ray facilities.
Yeah, they have everything, yeah.
And they have everything there. So one thing that you have here, again with the health insurance you have, is you can go directly to a specialist.
Yeah.
Whereas in the UK, whether it's private or non-private, you have to be referred by a GP, and there's a process that has to take place.
Yeah.
Right. So look, to conclude then, we feel that if you're going to talk about the differences, in terms of speed, it's definitely faster here.
No, it's
100% faster here.
It's faster, yeah.
To what we're used to in the UK.
Yeah.
To get an x-ray and to get all of these things done and be out in 2 hours is just crazy to us.
It's just,
I don't know what it's like in the country that you are in from where you're watching, but it's definitely faster here, number 1.
Yeah.
Number 2, in terms of the cost, for us, because of what we paid the tax in the UK,
and we had a top-up private...
Because we paid tax in the UK, plus we also had a top-up of private healthcare.
Yeah.
So for us, it's actually cheaper.
It's cheaper for us, yeah.
It's cheaper.
Yeah. We were kind of used to making these payments already because of the vitality.
We're used to making those payments, but even if you're taking the extra private healthcare off, just the money we were paying on tax, it would still be cheaper.
Yeah.
Because you don't pay tax here. And so essentially you pay for your own healthcare and it would still be cheaper, but we can go into costs potentially in another vlog because there's so many options available. You know, we probably need to go maybe talk a bit more on that, but generally look, it's cheaper than what you pay on tax in the UK from where we came from. So it's cheaper for us here than the UK, and the quality, the speed is better. In terms of the quality of care available, the specialists here are insane.
It's ridiculous.
There's so many. The availability of specialists here is just crazy.
It's a lot.
There's so many.
It's a lot.
There's just so many.
Wait, there's no queues. There's nothing.
There's so many.
Yeah.
So to conclude, I'm sure you probably know where this is going. But which do we prefer? And this is just us being honest, you know.
Yeah.
It's where we are right now. Look, we're going to keep you updated on our journey.
Yeah.
We always talk honestly from our experience. It just doesn't compare. Where the UK is right now in terms of healthcare, as a family and our experience of it, it just doesn't compare.
No.
Because it's all private, you need to be, I'm sure every single, you know, there's different standards, isn't it? And different things for different pockets. So you have to look around for, you know, what suits you and where you're comfortable and so forth.
When we say cheap, it actually depends on, you can get like health insurance with bells and whistles, and you can get health insurance in the middle, and you can get like really cheap health insurance. So again, you have to decide. There's, for example, before we go, there's one health insurance that you can get where you don't actually go to a hospital straight away. You go to like a clinic and they refer you. So you can even have that in place if you wanted to. So it really is your choice, the tier of insurance you go for. But I think the nice thing about it is that you can pay for the tier of insurance that you want. There's levels to what you want. If you want to go to a hospital that's, you know, amazing, you can go, or you can go to one that's in the middle, but you have that choice, because with the tax system in the UK, you don't have that choice. You have to go to the hospital that's available for you, whereas here, you can choose exactly what you want, where you want, and how you want it.
Exactly.
So that's...
My wonderful wife, darling Charmaine, has touched on the health insurance, but look, we don't want to go so much into it.
I just gave you a taster for the next vlog. And you have to put the, you got to comment down below if you want us to actually do one on like costs and bells and whistles and, the different insurances that you can possibly get. We're not experts. I'm just going to let you guys know. We're going to talk on our experience and what we've gone for.
If you need it. But the main thing here is basically just explaining to you that, what the comparison is for us and what we think of it generally. There's lots of different hospitals again, and there's lots of different options you have, but it's all private. And on the whole, in terms of what you're getting for your money, to us, it's fantastic. It's definitely an area that brings us a lot of comfort. I think moving over to a country from where you've come from, one of your big concerns is healthcare. Education, healthcare, all of these things. And we're definitely going to say that we are impressed by it. Again, if you're going to link into dentists as well, I think you were very worried about dentistry.
And that amazing as well.
And we found some dentists which are amazing, and the cost is very reasonable too. It's cheaper. It's cheaper.
To give you an example, in London, I had
to travel somewhere. Don't give the example.
Oh, I just told them I'm traveling somewhere.
Don't give the example of the cost.
You're not listening to me. I'm not giving them a cost at all.
Okay.
But in London, I had to leave the country to get my teeth done. That's all I'm telling you.
Because it was just going to be cheaper.
The cost wasn't
for her to do it.
It wasn't affordable. I found.
But here, it's all available and it's all around you. Dentistry, again, things like root canals, all of this stuff.
Serious teeth.
They're all available. And I'm just waiting to get my own Hollywood smile at some point when the time's right, because I'm going to do it here probably. So overall, we would definitely say, look, better here.
It is better.
If you're thinking of coming out here, do not be concerned, and don't be concerned about the price as well. It will be better for you. It's just better here. So we hope you found value in this vlog. Comment down below, interact with us. We love interacting with you guys, and it lets us know that we're just not talking to ourselves. And
I know we're not talking to ourselves because most of you come into my Instagram DMs. Can you comment down below here, please? I'm not answering your DMs anymore. That's actually now.
No,
I'm not answering anymore.
No.
I'm done. I'm actually done.
She will answer them.
No, I'm not. I'm
Continue
joking.
to DM too.
No, I'm joking.
She'll answer them too.
No, but you're better off putting the message here. Why would you leave the platform that you're on and go to another platform?
That's true.
It's easier here.
Or just do both.
Just do both.
We'll hop on both. So look, we hope you've enjoyed it. We hope you got value from it. If you're new to the channel, don't forget to subscribe. Also, watch our other vlogs on Dubai, and there's lots of valuable information on there. We're keeping you guys up to date on our journey. Don't forget to give this vlog a like, and we will see you on the next vlog. Peace out.